Thank you again, and dear colleagues, guests, honorable colleagues, and organizers. It is a privilege for me to welcome all of you for this event, and which is dedicated to innovation in health, and which aims to bring us all together to reflect collectively to how innovative solutions can make Armenia's healthcare system better, much more sustainable, and forward-looking future for the country can be built with these partnerships and collaboration. And we all know that health is not about any policy document, any idea in the air, an abstract idea, but it is about a mother sitting next, beside a hospital bed. It is a community protecting its older adults. Or it is a routine screening that finds a disease early with the workers to stop it there. So today that shared responsibility feels even heavier. New diseases emerge, conflicts and inequalities persist, populations age, climate change, and new technologies are advancing faster than at any point in human history, moving more quickly than our systems and our institutions can adapt. In the past, progress meant discovering new knowledge. Now, progress means ensuring that what we already know works and actually reaches every family, every village, every city, and ensuring it benefits people everywhere, not only in isolated projects or pilot programs. Innovation in public health is no longer an optional extra. It must become the backbone of how we protect and empower communities. It is not just about creating new technologies or dazzling breakthroughs. True advancement is not just invention. It is inclusion. And the World Health Organization guidance and toolkits for scaling innovations makes this point very clear. Scaling is a strategic imperative for transforming public health systems. Across nations, health leaders are called to embed innovations into government policy, to strengthen health systems and to position scalability as a central objective, so that solutions that succeed in one setting can be adapted and sustained across many. But scaling doesn't happen automatically. It demands leadership and vision. It requires political commitment, cross-sectoral partnerships, trust, and willingness to adapt. It means moving beyond short-term wins to build equitable, sustainable systems. Systems that are inclusive, affordable, and context-appropriate for the people that we serve. WHO guidance identifies three approaches to making innovation scale. Directive efforts that mobilize action, collaborative processes that align partners around shared goals, and supportive conditions that create fertile ground for innovation to thrive. Equally important is WHO's innovation agenda for public health, which highlights four mega shifts that must occur if we are to accelerate transformative innovation. First, we must reimagine partnerships, not as isolated efforts, but a quantum of collaboratives that tackle complex problems together. Second, we must democratize data and build ethical, inclusive digital infrastructure so that information empowers everyone, from health workers to health leaders, and to the citizens. So the third is that we must to invest in people, the workforce that translates ideas into impact. And fourth, incentives so that innovation rewards real-world health gains above all else, saying that the focus must shift from profit or novelty to measurable practical health benefits. And these aren't abstract concepts, they are blueprints for action. They remind us that innovation must be human-centered, guided by evidence, shaped by local needs, and sustained through collaboration. True progress means bringing disciplinary divides. Healthcare workers sitting next to the engineers, sitting around the table with data scientists, with community workers, and also bringing around the table people whose lives are most affected by our choices and by our inventions. So we've learned from epidemics, crises, and breakthroughs that progress is not linear. It accelerates when ideas are supported by policy, sustained through partnerships, and embraced by people. And WHO country office in Armenia supports our country and is dedicated to supporting our country in advancing these efforts, offering guidance, technical expertise, as well as convening key stakeholders, national and international partners around Armenia's healthcare priorities for a constructive collaboration to help translate both actions and innovation into real, sustainable health impact. So let us commit to lead not just with tools, but with courage. Not just with innovation, but with intention. And not just for today, but for generations to come. That is the future of public health, and it begins when we scale what works for all. I will stop here. I thank you, and I wish also